Good morning, YouTube family and friends. Well, I guess it's afternoon right now. Today is Saturday, January 31st, 2026. And this is my week 97 results of being back on Mounjaro while dealing with a host of medical issues. Uh, if any of you watched the full 41-minute video that I posted, I think Wednesday or Thursday. Oh, thank you. that was a long one talking about basically one thing. So I'm gonna try to give you a little bit more of what's been going on today. But I'll try to make it not so long of a video, but we will see. So I weighed myself this morning and I was at 205 pounds. That's a weight loss of 2 pounds in a week. I will definitely take that. That puts my total weight loss at 31 pounds since being back on Mounjaro. So I'm so close, being so close to being under 200 pounds. Oh, it feels so good. And I'm wearing my new jeans. I don't know if I told you on the last video or not. I need to buy another pair of jeans. I went to Kohl's and I was able to fit in a waist size 36. Ooh, ooh, that makes me so happy. It's going down, it's going down. Oh boy, yeah, I'm in a little bit better mood today. We'll see how long that lasts anyway. So, all right, got the weight out of the way. I wanted to touch base with you on a couple of things. I still have not called the attorney that the last attorney told me to call for a possible lawsuit against Inspire and the ENT doctor and others for misleading me on this Inspire device I have implanted that's preventing me from having an MRI. And they knew full well, because I'd said many times, no, I will need MRIs scans in the future because of my liver cirrhosis. So they knew I had liver cirrhosis. And they kept reassuring me, both the doctors, nurses, or assistants, whatever you want to call them, and Inspire rep. They all knew that. And they kept reaffirming to me that, yes, no problem. MRI, no problem. They just got to follow a few restrictions, but no problem, no problem. Yeah. Radiology said that the amount of heat that my battery pack can absorb without getting too hot and hurting me, that will be reached within the first 10 minutes of the MRI. So it is impossible for me to get an MRI of anything midsection. Now I can get MRI of the head, or I can get one of a leg or of an arm, but I will never be able to get anything of my chest and stomach area because of this. So I wanted to give my ENT doctor a chance to reply to me because the person who I've been talking to online through my chart, that's his nursing assistant or whoever she is to him, LPN or whatever she is. She replied back to me quite a while ago. It's been at least 3 weeks, I think, maybe 4 weeks. And she said that Dr. Please is going to try to get in touch with that radiology department and see what's going on, see why they won't do it. Even though I told them why they won't do it. So, yes, I am still thinking about filing a malpractice lawsuit on them. And so, but I was hoping to get a chance to see what the ENT doctor comes back with, but it's been long enough, so I think next week I'm going to call that attorney's office that I was referred to, and we'll see what happens. It's also been a while as well. I keep following up with my other attorney who was handling my claim against my car insurance company for, because I was injured on that hit and run while driving Uber. And Uber's insurance said that's not them. It will be my insurance since it went through my insurer. They're just like secondary or whatnot. So they said go through your insurer. So, which is good because the Uber insurance only had up to $25,000 for personal injury, and my car insurance has up to $100,000. So, but I called him, I think at the end of December. Yeah, that last week of December, and said, no, I haven't heard anything in a while. He says, no, I haven't heard anything back from State Farm either. So he said he was going to give him a call and get back with me. Well, he still hasn't got back with me. So I'll probably give him a call again next week to say, hey, what's going on there? So, all right, that's the updates on that. Oh, sorry, my hand's getting kind of hurting. My thumb's hurting from holding my phone on my knee. No, I didn't take the stand out, and I didn't want to be a whole lot of shaking with me just holding the phone outright. So, all right, next. Now I talked about my about my neurologist last week and how, I think I did anyway, and how he believes that my tremors and shakiness, I found out it's pretty much the same thing, are maybe it might have a little bit to do with MG, but he's still stating my MG is stable, my generalized myasthenia gravis. So I don't know what to think there. He says he believes that a lot of it is due to my stress and anxiety, and he recommends that I continue to work on that with my therapist and psychiatrist. Well, then the physical therapist and the speech therapist, helping strengthen my, kind of like, it's hard to explain, but it's not speech really. It's like the muscles, breathing and whatnot, try to strengthen those. So, but they both thought that I might be suffering from, one word for it is functional tremor. So, so I got paperwork on that. I know it's backwards for you. Then also understanding functional limb weakness. Now, it doesn't mean that I have any other neurological issues. So what they say is, it's kind of like they put it like like a computer. There's nothing wrong with my hard drive, which is my nerves and brain, but there's something wrong with the software. So, but I'll read just a little bit of this. It says, what is functional tremor? Functional tremor is the commonest type of functional movement disorder. In functional tremor, there is uncontrollable shaking of part of the body, usually an arm or a leg. This is due to the nervous system not working properly, but not due to an underlying neurological disease. Functional tremor is sometimes mistaken for Parkinson's disease or other causes of tremor, such as essential tremor. Unlike Parkinson's disease, functional tremor is due to a reversible problem in the way that the nervous system is working. This means that a functional tremor can improve and sometimes go away completely, although there is no magic treatment. And then it goes on for what are the symptoms of functional tremor. My hand's trembling, that's holding the paper. Stop shaking. Okay. A tremor is a rhythmical movement of an arm, leg, or other body part, such as the head. Functional tremor may come and go through the day, which mine does. The tremor may become violent at times and change in speed. Yes. Having a functional tremor can be disabling as the movements cannot be controlled, i.e., they are involuntary. Yes, that is true. They come at the, I don't know, but they definitely come on no warning. Functional tremor often begins quite suddenly, but may be gradual. It may follow on from one of the following situations: a physical injury to a limb or pain, which I do not have. Let's see. After getting a tremor from a medical problem, such as a side effect of a medication, which, it's possible with my psychiatrist medications. Faint with some jerky movements. Haven't fainted. An infection which had caused a high temperature and shaking. Nope. So I think that number 2 is a medical problem. I think it could be side effects of my medications. Okay, number 3. After having a fright or panic attack. Nope. With number 4. With a symptom called disassociation, spaced out or zoned out, which can happen without any feelings of fear. Possible. Number 5, an underlying mild additional cause of tremor, such as essential tremor, has become amplified because of functional tremor. So, yeah. And it kind of goes on a little bit more. The diagnosis, how is the diagnosis made? The diagnosis of functional tremor is usually made by a neurologist. It can be a particularly difficult diagnosis to make because it requires expert knowledge of the full range of tremors due to neurological disease, which is myasthenia gravis, many of which are unusual. Then the following are some examples of things a neurologist would look for to diagnose functional tremor. Tremor that disappears transiently or changes in rhythm when copying movements with the good arm or leg. This is called entrainment test. And number 2, difficulty making rhythmic movements with your good hand or leg. Number 3, times when the tremor is absent. Variable frequency means varying speed of how fast the shake is. Tremor that gets a lot worse when someone tries to hold your arm or leg still. I haven't tried that yet. So it's possible. It's possible. I see the new neurologist that my neurologist recommended. She's in the same department as my neurologist, but her specialty is more with this. I see her, I believe, on the 16th. Yes, 16th of this month of February, or February 16th. So a couple weeks. And then also my physical therapy people thought, no, not them, it was my speech therapist. Or was it one of them? I don't remember. I see them both on Mondays and Fridays. This is what I got yesterday, Friday. They think it's something, maybe it's possible, it's probably something that's adding to it, or it could be the main cause of my tremors or shakiness, besides MG or besides stress and anxiety. And they call it some type of metabolic health. So I made an appointment with a clinic that says CHI Health Clinic Metabolic Health. It's way out in Elkhorn, Nebraska. Ooh. But she said that they'll check. They'll check like your vitamins in your blood and all that stuff. I said I already have that done, and she says no. They will check a lot more and go in more depth of it to see anything that could be going on. So she says not just a simple blood test that I get done regularly. This is more in depth. They can look for a lot more. So I say sure, but my earliest that I could get into them was May 14th. They did put me on a wait list if they had any cancellations, but if they don't, then I see her on May 14th. So there's the update with that. I got to switch knees. Oh, right leg was starting to shake a little bit. So, all right. What else? I think I already told you the liver doctor doesn't want to do a 3D CT scan because I asked her, it's like, can we decide by doing can we decide between that the look of my stomach was either between a scarring that's more developing from my bariatric sleeve that I had done way back in 2016, or is it from my PHG, which is portal hypertensive gastropathy. That's hard to pronounce. So, and I asked her, no, and she came back and says, well, no, I was thinking maybe you could see what the pressure is in that portal vein, and no, since the endoscopy showed that my varices in my esophagus is no longer there, and it's been shown there the last two other endoscopies, so it's possible the pressure just changed to other areas, which it could be to the stomach. So it backed off on the amount of blood sending it through that vein through the esophagus and moved it more into the stomach, because I guess stomach can hold more. When it comes to the veins, the blood vessels in it. So, and that could be why you saw all that redness in those 3 or 4 pictures from the last video. That could be a lot of reasons why that redness is there, because it's not bleeding yet. But I had mild PHG on my last endoscopy back in 2023. And so it could very well have increased to moderate PHG. But the liver doctor says in either case, it's not going to change the treatment that I'm getting. So, because all we would do on that is just keep on monitoring it. So, and the medications for it would be beta blockers, which I can't take because of my bradycardia, my low heart rate. Even though my low heart rate has gone by, ever since I started taking these medications from the psychiatrist, my heart rate, my pulse has been up in the 70s and 80s. I haven't had any 60s or 50s and some 40s, no more. So it doesn't mean that I still don't have bradycardia. My heartbeat is just higher due to the medication. If I would come off all of these medications that the psychiatrist has me on, it could very well fall back into the bradycardia level. So, but that's why I'll never be able to take beta blockers, which is not good, because that's the first medicine when the liver cirrhosis gets worse, is beta blockers. So, all right, folks. Yeah, I think that's all I'm going to talk about this week. I know I said like 3 videos ago that I might talk about how my therapy session went, the one that I cried in, but that's too personal. I'm sorry, folks. I'm not going to talk about that. Yeah, that's too personal for this one. I'm sorry. No, I'm usually wide open. Mostly, you know me. I'll tell you everything that's going on about me. But yeah, what I talked about with my therapist in that session, I'm going to keep that to myself. I hope you understand. So, okay, that's all I got for you. I hope you enjoyed this video, and hopefully you get something out of my videos, especially if you're dealing with the same things, or if you know somebody who's dealing with the same things. So, all right, you all have a great day. Be kind to everybody, and be sure you tell your loved ones and your friends that you love them. And I love you all. Have a good one. Bye-bye.